Prevent disease, promote wellness and safety, protect the health of our community. The 133 employees of the Dorchester County Health Department provide a range of needed and valuable services for the residents of Dorchester County, Maryland. Our health education department works with multiple different community organizations such as local churches, youth groups.
I stayed in youth action counseling so I can help people and improve their daily lives.
And what we do is we go around the community helping adults and children to stop underage substance abuse.
And even law enforcement, and can really tackle a variety of problems. The goal of this program is to promote healthy choices. One example of this is through tobacco cessation programs.
Well, I smoked cigars all my life and I wanted to save some money and I wanted to get off of them. I'm 46 days free. I mean, I didn't just come here for to play with everybody. I come here for to quit because I was smoking over $100-some a week on cigars. I'm glad it did come. I really am.
Our school health program provides staffing where a school nurse is placed in all 11 schools across the county, which is important because these nurses conducted almost 75,000 visits and dispensed over 25,000 medications last year alone. We also staff trained medical and mental health professionals in 4 school-based wellness centers who provided almost 4,500 visits last year, keeping kids in school and their parents at work.
There's this option at our school that I can't believe is even available. I was having a lot of issues with my menstrual cycle, and I went down to see Dr. Scott, and she told me that birth control by itself would just help with a lot of the issues that I was experiencing. And a couple days later, we scheduled the appointment and she took me down to the health department.
We are seeing a lot of children who come to school who need to take medications during the day or who have chronic health conditions that need to be managed.
Well, they checked my blood pressure. It was really high. It was like 190 something over 100. Now I take medicine for my blood pressure, and honestly it's because of them.
Our immunization program provided over 1,800 vaccines last year. We travel to schools across the county to administer annual flu shots, and we offer that same service to local businesses. Our health clinics offer preventative health visits, cancer screenings, family planning resources, and just last year performed over 1,000 HIV and other STI tests. Our home visiting program, Healthy Families, targets at-risk pregnant women and families with newborns. Visits focus on attachment, nurturing, and healthy child development. And last year we served 100 families.
They helped me and I was able to receive my diploma. So when I got pregnant with my first child, of course I was 14, 15, going to 15. And I remember I was so embarrassed, I wouldn't even go eat my lunch. And like I said, Happy Families was there to say, it's okay, you can still do it. You do your best. I did my best and I think they turned out good.
Our behavioral health program provides comprehensive treatment and recovery services. We oversee a peer support program at Dry Dock, which helps to connect people to employment opportunities, housing resources, and encourages them to stay in treatment. We also train citizens on how to use naloxone, a life-saving medication for opioid overdose. We trained over 350 citizens just last year. Although we serve all members of Dorchester County, we do pay special attention to vulnerable populations, so that's the elderly, as well as those who don't have transportation. So our health department helped to coordinate over 31,000 visits to doctor's offices just in the last year.
All right, just remember to call the bus to get your pickup time.
Recuerda llamar un día antes de tu cita a la 410-221-1910.
And we have a dedicated team with our emergency preparedness division. We prepare ahead of time, we do drills, we assign roles and responsibilities to staff members so that they know in the event of an emergency where to report and what's expected of them. Even after an emergency occurs, the recovery process is often overlooked, but that's something that we take very seriously to help build community resilience and to help get the community back on its feet. Some of the more visible people who work for our health department are those who work in environmental health. A lot of what they do is come out to local businesses, construction sites, inspecting restaurants, overseeing wells and septic permits. And a lot of this is really with the common vision of trying to keep our residents safe and our waterways safe. From disease prevention to crisis intervention, from birth to death, We are working in partnership with the community to make a safer place for healthier people.